What if I told you that 95% success rate for dental implants is actually terrible? Or that the number one reason implants fail isn't what most dentists think it is? Hey everyone, I just got back from the 2025 Osteogenics Soft Tissue Symposium, and one lecture absolutely blew my mind. Periodontist legend Dr. Fugazato, with over 40 years of experience and 40,000 implants placed, shared some controversial insights that could completely change how we approach implant dentistry. Stay with me until the end because I'll share the single most important factor for long-term implant success that most dentists are completely overlooking. In today's video, I'll break down why this expert believes we need to redefine what success means in implant dentistry, the surprising truth about gum tissue thickness that challenges popular European techniques, why he believes inflammation accounts for less than 5% of implant failures, his controversial approach that helped him achieve a 99% success rate over 10 plus years, and the single most overlooked factor in implant longevity that completely changed my perspective. Let's dive in. If we haven't met before, I'm Dr. Choi, board-certified periodontist since 2011, and I'm passionate about helping patients achieve lasting results with their dental treatments. I've been placing implants since 2009, and I'm always looking to learn from the best. This past week at the Osteogenics Symposium, I heard something that made me question some fundamental assumptions about implant dentistry, and I just had to share it with you. The speaker started by challenging our definition of success. He said showing cases that are successful for just 2 to 5 years isn't enough. His focus, multi-generational success. What struck me was his certainty. He showed cases from patients he treated 30 plus years ago, people whose implants have lasted longer than some marriages. One quote really hit home. What we used to call success 20 plus years ago, I would call failure now. He doesn't believe in partial success. It's either success or failure, period. There's been this trend, especially from European techniques, emphasizing thinner gum tissues for better aesthetics. But this Boston expert had a great comeback for that. He said, you know what's unesthetic? Failure. When your implant falls out, that's unesthetic. He showed cases where implants with thin surrounding tissue eventually failed, while those with thicker tissues, even if slightly less aesthetic initially, were still functioning decades later. For healthy gum tissue, he recommends a minimum of 3 millimeters of healthy attached gum tissue, using biologic proteins called endogain to enhance healing, and ensuring the tissue is firmly attached, not just present. He criticized what he called happy but pointless grafting, procedures that look good but don't address the actual biological needs of the site. What resonated with me was his focus on function over form, making sure the tissue is doing its job, not just looking pretty. Now here's where things get controversial. This expert believes that inflammation around implants, periimplantitis, accounts for less than 5% of implant failures as the primary cause. Instead, he points to something completely different, the forces from teeth grinding and clenching. According to him, if you don't manage these forces, even the most perfectly placed implant with excellent bone and gum tissue will eventually fail. He showed case after case where implants had failed not due to infection or poor placement, but because patients were grinding their teeth and creating forces that the surrounding bone couldn't handle long term. And this is why I work so closely with prosthodontists. I truly believe they are the experts on managing the complex bite of each individual patient. If the bone isn't there, it's not going to make a difference, period. That was his take on the importance of bone. He shared his formula for success: adequate bone thickness, at least 2 millimeters on the edges, proper gum tissue management, and controlling grinding forces. With this approach, he's achieved a 0.9% implant loss rate over 10 plus years across thousands of patients. That's not 95% success, that's 99.1% success. He made a powerful point. With a 5% failure rate and 500 implants placed per year, you'd have a failed implant every other week. Is that acceptable? This brings me to the most overlooked factor in implant success, the one I promised to share at the end of this video. It's muscle management, specifically managing the forces from clenching and grinding. This expert uses muscle relaxing treatments, similar to Botox, for diagnostic purposes to see how the bite changes when muscles are relaxed, reducing post-operative pain, improving treatment results, and ensuring long-term success. He believes virtually everyone clenches to some degree. The question is just whether it's clinically significant enough to damage implants over time. And I completely agree with him. I have found myself seeing clenching and grinding to be a common reason why patients have issues with their implants, and now use a lot of Botox in my practice. Even I find myself clenching quite a bit and inject Botox in my masseter muscles every 6 months. Bottom line, it's not just about perfect surgical technique or the right materials, it's about managing the entire system, including muscle forces. As I reflect on what I learned at his presentation, 3 key lessons stand out. Number 1, success in implant dentistry requires addressing bone, gum tissue, and controlling grinding forces. Number 2, we should aim not just for short-term success, but for multi-generational success. And number 3, we must be willing to do the appropriate amount of work required for each case. No cutting corners. The speaker concludes with a quote that stuck with me. Our definition of success is limited by our perception of possibilities. This lecture has truly expanded my perception of what's possible in implant dentistry, and I'm already implementing these techniques in my practice. So what do you think? Has this changed how you view dental implant success? I'd love to hear your thoughts in the comments below. If you found this valuable, please hit that like button and subscribe for more insights from my continuing education experience. And if you're a patient who's watching this who's considering implants, I hope this gives you some valuable questions to ask your dentist about long-term success. Thanks for watching, and I'll see you in the next video.